This film is about first aid in motorsport. It accompanies an introductory video and deals with more advanced issues, such as removing helmets and the hands device, supporting the neck of a competitor with a suspected spinal injury, more advanced techniques for opening an airway which are not now taught as part of a standard first aid course, and how to help casualties in a vehicle that is on its side or its roof. It is aimed at experienced marshals and also competitors, and is intended to be used in training sessions where those taking part will have an opportunity to practice these skills under the eye of an experienced trainer. The first priority in any incident is your own safety, followed by the safety of colleagues, competitors and bystanders. Once the dangers have been eliminated, or at least reduced to an acceptable level, you assess the responsiveness of the casualties and then shout for help if you are on your own. If you have an unresponsive casualty, you ensure they have an open airway and check their breathing. If a casualty is still wearing a helmet, you should attempt to open their airway by supporting their head in what is known as neutral alignment. That is the normal position the head is in when you are standing or sitting, looking straight forwards.
Can you hear me, driver?
Tell the casualty what you are doing. Even if they appear to be unconscious, they may still hear and remember what you are saying. So be positive and polite and don't express any views about their condition.
Undo your chin strap now.
It is vital that a rescuer supporting the head is comfortable, as once they begin supporting the head, they must not let go until another rescuer takes control of it. Before the visor is opened and the chin strap released, the best way to support the head is to hold the helmet by placing your hands approximately where the casualty's ears would be. Alternatively, you could support the top of the helmet and chin bar, or if you are on your own, support the chin bar with one hand while you open the visor with the other. Once the visor is open, you can try to assess the casualty's breathing. If there is a problem with the casualty's airway, or they are not breathing and they are wearing a full-face helmet, there is little you can do to help them until you remove the helmet.
If you want to take the helmet off now.
Taking a helmet off normally requires two people who have been trained and have practiced the skill. If you need to remove the helmet, once the visor is open, check to see if the casualty is wearing spectacles and remove them if they are. Then release the chin strap. Try to familiarize yourself with the way chin straps are fastened before you have to undo one in real life. But remember, in an emergency, don't waste time undoing the chin strap. Cut it using scissors. Once the spectacles have been removed and the chin strap undone, the next step is to release the casualty's seat belts and move them out of the way. If the steering wheel can be removed, take it off. This usually involves reaching between the spokes and pulling the retaining collar behind the wheel towards you to release it. Carefully remove the wheel and put it well out of the way. So to recap, if there are two rescuers, the first supports the casualty's helmet, while the second opens the visor and checks the casualty's breathing. If the casualty is breathing and there is no pressing danger, support them where they are and keep monitoring their breathing and response. If there is a problem with the breathing, the second rescuer removes any spectacles, undoes the chin strap and seat belts, moving them out of the way before detaching the steering wheel to create more space. The second rescuer can now take control of the casualty's head. The best way to support the head is from the front, slipping your hands up under either side of the helmet with the first and second finger of each hand above and below the jawline on either side of the casualty's head. Thumbs on the casualty's cheeks or chin, and the other two fingers of each hand around the back of the casualty's neck. Hands devices are increasingly being worn by competitors to protect them against spinal injuries. It is more difficult to support the neck of a casualty who is wearing the hands device, but still possible using this technique. Once the second rescuer is confident they have secured the casualty's head and neck, they can tell the first rescuer to release their hold on the helmet. If the casualty is wearing a hands device, The first rescuer must now detach the hands from the helmet. The hands is attached to the helmet by straps with metal catches and secured under the competitor's seat belts, limiting the movement of the head in a crash. Don't try to release the catches which attach the hands to the helmet, as this would cause the head to move. Just cut the straps between the helmet and the hands and leave the hands where it is, on the driver's shoulders. If the casualty is in an enclosed cockpit, take a look at the space between the top of their helmet and the roof of the vehicle. Ask yourself if there is enough space to lift the helmet off. The answer could well be no, in which case you will have to carefully move the casualty down in their seat to create enough space to remove the helmet. While the second rescuer continues to support the head, the first grips the casualty's race suit by the thighs, lifts and pulls them gently down the seat to create sufficient space. The first rescuer now grasps the chin strap on either side of the helmet or slips their fingers under either side and eases the helmet apart. Keep explaining to the casualty what you are doing as you rotate the helmet backwards so that the chin bar clears the nose, and then lift the helmet off. Check the casualty's airway and breathing and commence resuscitation if necessary. If you do need to resuscitate a casualty, you may need to remove the hands device. There are two ways of doing this. The first method involves the rescuer who removed the helmet taking over the job of supporting the casualty's head and neck. Once they have control of the head and neck, the other rescuer rotates the hands device through a quarter turn and slides it off over the casualty's shoulder. Take extreme care, as the hand shoulder support will put pressure on the casualty's throat, and this procedure will be very uncomfortable for a conscious or semi-conscious casualty. The second method involves the rescuer who removed the helmet sliding the hands device upwards and slightly forwards so that the shoulder supports slip up the back of the neck behind the casualty's ears. Although this method avoids putting pressure on the casualty's throat, it may involve moving them forward slightly so that the hands device does not catch on the back of the seat. Which method you choose will depend on the circumstances and the type of seat involved. You may need to remove the casualty from the vehicle if you cannot perform CPR while they are seated. If you have to take the casualty out of the car, try to maintain stable support of the neck. But remember, the priority is airway, breathing, and circulation. There is a danger that an unconscious casualty's airway will become obstructed, irrespective of whether they are seated with their head in neutral alignment or slumped forward. The same is true if it has been necessary, for instance, because of the risk of fire, to remove a casualty from their vehicle and lay them on their back. In high-speed motorsport accidents, we always have to be aware that the casualty's spine may have been damaged. Establishing an open airway takes priority over concerns about a potential cervical spine injury. But a rescuer can minimize the risk of further damage when opening the casualty's airway by simply using a chin lift without a head tilt, while a second rescuer uses manual inline stabilization to secure the spine. Alternatively, if you have had the appropriate training, you can use a technique called the jaw thrust, where the rescuer's fingers are placed behind the angle of the jaw and pressure is applied upwards and forwards, while the thumbs are used to open the mouth slightly by gently pressing downwards on the chin. The jaw thrust is not recommended for lay rescuers because it is difficult to learn and perform and may itself cause spinal movement, so it is important that you have been trained if you are to use this maneuver. As a last resort, if the casualty's airway is still obstructed despite the use of the chin lift and jaw thrust techniques, you should resort to tilting the head a small amount at a time until the airway is open. That's all very well if a car ends up on its wheels after an accident, but what do you do if it rolls and ends up on its side or roof? When a car rolls, you must always suspect a neck injury, so heaving it back on its wheels risks making any injury worse. It could leave a competitor in a wheelchair or even result in their death. As always, check for and minimize any danger.
Just hang back a sec while I talk to the
If
driver.
you are on a rally, send someone back up the stage to slow down other competitors, because you can be sure that you won't have cleared up the incident before the next competitor arrives at the scene. Next,
Hey driver, you all right?
check the response of the competitors in the car and work out what you need to do.
Can we have...
If the competitors are conscious and uninjured, quickly check the state of the car. Ask yourself if it is likely to be able to restart. If it is, then a controlled roll, putting the car back on its wheels on the road, is likely to be the best option.
Okay everyone, well done.
If the car isn't going to restart, you can either help the competitors out of their upturned vehicle or roll it back on its wheels in such a way that it doesn't block the stage before helping them out. Only someone on the spot can decide which is the best course of action. If you are helping a competitor out of an upturned car, remember to physically support them and get them to support themselves before releasing their belts and lowering themselves gently onto the roof so that they can then crawl out.
James, I need you to get inside. Can we have...
If you are righting a car on its roof with an injured or unconscious competitor inside, someone must be inside the car supporting their neck. If it's a rally car and the second competitor is able to provide support, let them. Otherwise, put your smallest experienced marshal inside. Get 6 to 8 people together to lift the car onto its side. Think about which way to roll the car. You must minimize the movement of the casualty. So use the side where the casualty is as the pivot point, because that will minimize the amount of movement they will be subject to and stop their full weight being supported by their belts.
Around this side now. A couple of people...
Pause when the car is on its side. You are now in the same position you would be if the car had come to rest on its side. Check the casualty and the marshal inside the car, then send the majority of your colleagues round the other side to support the car and lower it onto its wheels.
Okay, we're just going to...
If you simply shoved the car onto its wheels at this stage, you could do serious damage to the casualty's spine. With the minority of your crew pushing on the bonnet, boot and roof, and a limited amount of pulling by the people on the other side, you can now tip the car over further until it is supported by majority, who can then lower it slowly onto its wheels. Follow a similar procedure, but without a marshal inside, if the competitors are conscious and uninjured. But never ever heave a car over onto its wheels. Remember, the key to avoiding further injury and worse is to take things slowly and gently, and to make sure you have plenty of people to take the weight of the car and lower it onto its wheels.
Now.
What you done?
I think I've broken my leg.
Right, okay.
What do you do if once you have a conscious casualty in a safe place, you find they have a broken limb? Although it is usually best to let a casualty support a broken limb themselves or sit in the most comfortable position, bandaging or splinting may be necessary to immobilize a broken limb and provide extra support and comfort, relieve pain and reduce bleeding. Don't make bandaging too tight or you'll restrict the circulation. If a casualty with a fractured leg cannot be made comfortable as they are and their other leg is uninjured, that leg can be used as a splint. Put traction on the injured leg and bring it into line with the good leg. Maintain the tension to stop the broken ends of the bone rubbing. Put a figure of 8 bandage around the casualty's feet before bandaging above and below the fracture and around the thighs if the lower leg is injured and vice versa if it's the upper leg. Put padding between their legs to prevent the bones rubbing. If the casualty is wearing leathers, leave them on as extra support. But caution, always treat someone who has been injured in a motorsport accident as though they have a spinal injury until it's proved otherwise. Do not move them unless they're not breathing or in danger from fire, as they could end up paralyzed. Warning signs of possible spinal injury are pain in the neck or back, pins and needles in arms and legs, or not being able to move limbs. But remember, 50% of spinal injuries are not immediately apparent, so keep them still if at all possible. In conclusion, this short film incorporates what is regarded as the best advice at present for treating casualties, and we trust that it will prove useful should you ever find yourself in a position to need to offer such assistance. It is not intended to be a substitute for attending appropriate first aid or life support training courses. Hence, the life-saving and rescue techniques are shown for demonstration purposes only. The Motorsport Safety Fund wishes you safe and happy motorsport.